everyone. This is Vanita Lambert, and you're watching the David Goodman Reality and Truth Show. I want to thank you so much for joining me today. I'm going to be talking about a couple things. One of them is a really important. Medicare annual enrollment period is coming up really soon. That's October 15th through December 7th. So I want to talk a little bit about that and some of the special enrollment periods. And I know I sound like a broken record, but it's so important that you get this information. But before I get into that, I just like to, explain to everybody why I talk about these different categories, and why I do Radio 1400.am. That show is called the Medicare and Retirement Planning Show, and it is a free show that you can listen to. It's on demand. It's on smart speaker. You can listen to it over your flip phone. If you don't have a smartphone and you just have the flip phone, you could dial into the station's number and listen to it. We just try to make it available on every single platform possible, and plus tell you about it on this platform. And the reason for that is Medicare is just so complicated. And, like I said earlier, I started out in this business in 2014. And just like everybody else, it was just a job to make money, to pay my bills, just like everyone else. And then a couple years into it, I realized that I really loved what I'm doing. And I, developed this deep passion for what I was doing. And now it's like a little ministry, because I realize that I'm just not out here, putting people in plans and moving on and this and that and the other. I am making their lives better. I am helping them save money on the Medicare savings program. I'm helping them protect themselves, their families, and their nest egg. So that's really important to me. And when I save the money, it feels like, I'm saving money. And the reason I started doing this is because I sit down with about 10 to 15 families every single week, and we talk about the 4 areas that will affect their lives the most, which is Medicare, long-term care, life insurance, and retirement income. And, as I'm talking to these families, I noticed that most of them did not have the information. And so the information to take advantage of benefits. If you don't have that information, then there's just no possible way that you can take advantage of the benefits. And I wanted to reach as many people as possible. And so I have this platform, and I'm also doing it on the radio. I do free church seminars. I do free seminars in senior centers. I'll do it in a library. Anywhere people need information regarding this type of insurance, health insurance, which is extremely important, I am available to give out free information. And a lot of people ask me, well, how do you get paid for this? I'm like, well, you don't pay anything for me to come here, so it's just free information. And it's all confidential. I'm licensed in the state of Connecticut, North Carolina, and Maryland, and New York currently. Haven't done any business in New York, so I'm thinking about dropping that one. It's just another expense, but we'll see what happens with that. So my goal is being a person that came from an area where there wasn't any information. That's what I'm passionate about. I'm passionate about giving out the information. One of the things that I really am truly passionate about is I'm not, and bothers me a little bit, I'm not sitting down with enough millennials. There are so many millennials out there that don't have this information. And especially if you came from an area, a humble area, poor area, like I did, and you're not going to have anybody to leave you this big, huge inheritance. You know, everybody is not blessed with an inheritance, and you have to start your own legacy from scratch and create it yourself. I have the tools to show you how to do that. And like I said, it's free information. I'll go anywhere in Connecticut. Or if you don't have a place for me to come, your job or your own house, maybe you're sharing a house with a roommate and you want privacy, you can come to one of my offices in Shelton or in Farmington. And if you're from this area, I prefer Shelton. We're right on Research Drive. And I'll be happy to schedule a visit with you, sit down with you, and show you how you can create your own legacy at a very early age. I did this with my son when he graduated from college. He had just came home. He was home a couple months, and I wanted to see how it would work with you young folks, so to speak. And I set him down. It took me about an hour or so. Went through everything. Went through the now money, your later money, and then your retirement money. Explained it all to him. And he was like, "Ma, I didn't learn anything like this at school. And I really, really appreciate you telling me about this. But I'm just not interested in it right now." So I was like, okay, I was a little mortified. But I was like, I appreciate your honesty. And I'll take that note under consideration. But I think he knew that if I knew he wouldn't do it, that I would do it for him. And I am doing it for him. I believe in legacy. I believe in leaving a legacy for my family. And that's what I'm about. But everybody has, everybody's different. Everybody have their own concerns, what they're passionate about, or what keeps them up at night. Are they going to have enough money to pay their bills or health care or long-term care, whatever. My thing is legacy because, I basically came from nothing. I had nothing, and I had to generate it all myself. So, having said that, you should take me up on that note. That's pretty good information that I can give you guys, you young folks, on how to start your own legacy, especially you young entrepreneurs that have your own business. You're independent contractors. You're not going to a Yale hospital where they're giving you a 5% 401k match. And what are you going to do when you retire? Especially if you're a young entrepreneur who, like I said, is not paying into the system. If you're not paying into the Medicare system, Social Security, you're not going to get anything out of it. So you have to start planning really early. In order to be eligible, I used to think Medicare was free, but it isn't. In order to be eligible and entitled to Medicare Part A, which covers the hospital, you have to work 10 years or in any combination of 40 quarters in this country and pay into Medicare in order to be entitled to Medicare Part A, which is inpatient hospital. And then Medicare Part B, there is a cost to it, okay? You pay a monthly fee, a monthly premium, and it only covers 80% of your outpatient hospital visits, like doctor's office and things like that, medical supplies. So then you have to cover the other 20%, and there's two ways that you can do that. You could do that with a Medicare Advantage plan, or you could do that with traditional Medicare. And if you do it with traditional Medicare, you're going to need also to pay a couple other premiums, which are supplemental insurance, or Medigap as you call it, and a drug plan, because you have to have that, which is included in most parts of the Medicare Advantage plan. What's the difference between Medicare supplements and Medicare Advantage? So if you're on a traditional original Medicare, you get to see any doctors that you want. You don't have to have any referrals from your primary care doctor, and the costs are going to cost you a lot more. Those are some of the things. If you're on a Medicare Advantage, which is also known as a Part C plan, Then there are restrictions. You have to go to providers, doctors in the network, okay? Your Part D is already included, so you don't have to pay for that. And it covers everything in Part A and B, plus it gives you some additional benefits like dental, vision, hearing, free gym membership, some over-the-counter stuff, things like that. So those are the differences between those two plans. All right. And then the enrollment periods, you have, like I said, the annual enrollment period is coming up. October 15th is just about a month away. Today is what? So just say about 5 weeks away. So you want to start scheduling, looking at the plan you have, seeing if your medications change, or just see if you need an annual review, a confidential free annual review, I should say. And the time to do that will be between October 15th and December 7th. That's your annual enrollment period. The next enrollment period is your open enrollment period. So those are it's called OEP, Open Enrollment Period, MA, for Medicare Advantage plans only. So you can only switch your Medicare Advantage plan during January 1st and March 31st. So keep that in mind. There's a huge difference between your annual enrollment period and your open enrollment period. And then, of course, there are special enrollment periods. And special enrollment periods are special because you can enroll into Medicare at any time you lose coverage from your job. Say you retire from your job or you get laid off or something, or if you become eligible for additional help like low income subsidy, things like that. You become eligible for the Medicare Savings Program and things like that. So those are special enrollment periods, okay? So keep all of those things in mind. And I have here, I want it to be like, the people on the news. I got my laptop up and it's so cute. Anyway, it's not all that. So anyway, I am right in the middle of taking my AHIP. And AHIP, I am certified in AHIP for 2022. I'm now taking it for 2023. What is AHIP? AHIP is American Health Insurance Plans. I have to get at least a 90 on the test, okay? And you have to take them every single year in order to offer Medicare Advantage plans and standalone Part D prescription plans. Why is that? Because there are changes in Medicare every single year. So that's the purpose of the recertification for all of the Medicare plans. And I am contracted with different plans so that I'm not going to sit down with you and put you into one plan. I don't work just for one company. I'm contracted with others. So I ask questions, okay, to see how you're situated. And then based on your answers to my questions, I take that information and I make the appropriate recommendation, starting with your medications. If you are taking medications, that's going to be the most expensive part of your plan. So that's how I start. And once I figure that out, once we figure out what your medications are, then we make sure that your doctors are in the service area and, you have all of your benefits. I go over every single benefit with you. I know a lot of folks on Medicare Advantage plans, and you're just not taking advantage of all of the benefits. You have to read the back of the book. Every home that I leave, I make sure that you know about all of the vendor information, who to contact for vision, hearing, dental, over-the-counter medications, and your gym membership. You have to just call the number on the back of your card. There's got to be a customer service number on the back of your ID card, and you just call those guys and ask them whatever you need to ask them, and they will direct you to the right department if you're not in the right department. So I think that, that's just really important that you utilize all the benefits that are available. Because if not, the plans might switch and say, okay, well, nobody really used the over the counter stuff, so let's take it out. Hopefully that doesn't happen. And, I'm not saying that it will, but, if it's not a concern, then they might look for something that is a concern. There's a lot of really good information coming out for 2023, but I can't talk about it yet. I can't talk about it until October 1st, so I'm just talking about the 2022 plans. It's Medicare, the CMS rules, Centers for Medicare, they are very strict about the information that we give out. So they tell us that we cannot talk about any of the new plans until October 1st. As a matter of fact, I don't know about all of them yet, because what happens is all of the Medicare the private companies that sponsor the Medicare Advantage plans, we have meetings all throughout the month of September, and then I have one more left in October that I have to take, and I'm not even sure what all of the benefits for 2023 is. So that's some of the information that we do get. So I just want you to be aware of that. And also I'm going to be doing a community hour regarding Medicare on radio 1400.am, where I'm going to give out a phone number on that station. I haven't set a date yet, sorry. But I'm going to be giving out a phone number where if you have questions, you could call into the radio station. You'll be on the radio live, ask us a question, and we'll be able to answer that question for you. So I think that's pretty interesting. I'm looking forward to it, and it's a lot of fun. And I'm also going to be on Connecticut at Your Service with Carmen Nieves. I'm excited about that. I think it's going to be November 1st. It's a Tuesday. I think the date is November 1st. But and it comes on at 6:30 p.m. to 7 o'clock. It's on every single Tuesday. Carmen has a special guest that she interviews for the first 15 minutes of the show, and then they take calls. So then the last 15 minutes of the show, you're allowed to call in and ask any questions that you want. So I'm going to be doing that for Medicare. Hopefully I'll do one in November and then another one for the upcoming enrollment period in December, just because this information is so important. And it's really, really important for all of the people turning 65, all of the new Medicare clients that we're going to have. It's just so crucial, because in the past, when you're working for a company, what happens is you go into a conference room, and if you're single, you take package A. If you're a couple, you take package B. And if you have a family, you take package C. With Medicare, it is not that simple. They send you a big I think it's like 250 pages that you need to read. It's called Medicare and You 2023, or whatever year it happens to be. And it's just general information. It's not specific to any one person. And that's what makes it so confusing. And then there are just so many moving parts, so it's just confusing. So what I try to do is simplify that for you by asking questions, and your answers will tell me exactly what you do, or exactly what you need, I should say. And that's how I put together a plan for you. And once again, like I said, it's a free confidential needs analysis. I'm a licensed professional. I don't share any information whatsoever. Okay? So, we have to make sure that you have, the right healthcare plan. I can't think of anything more important right now than your healthcare. I mean, your healthcare plan and your health. If you're not healthy, then that eliminates you from a lot of things. So you want to make sure that you're in the right plan, and you want to make sure that you're going for all of your preventative care checkups. You want to go for your annual checkup. If the nurse wants to come in and give you a gift card for doing a free checkup, then you might as well do it and get a free gift card at the same time. You want to get all your hearing, dental, vision. Go once a year. All of them are free. Have your blood work done. And this way, if anything is wrong, you get to nip it in the bud. You don't wait until it grows. Don't wait until something's been bothering you for 2 or 3 years and then decide to go to the doctor. That's just not good. Whether it's your back, your knees, or just whatever it is, because you never know. Waiting that long, if something's bothering you and waiting that long, you're just, in my opinion, just making it so much worse. So at the risk of redundancy, go get your checkups and make sure you're in the right healthcare plan for this upcoming Medicare annual enrollment period. Okay, and also find out about the things that are not covered by Medicare. They are covered by Medicaid, but not Medicare. Know the difference between the Medicare Savings Program, which is on that little gray card, and Medicaid, which is on that little gray card. Ask questions. Don't take anybody else's information, like your neighbor or your sister, just because they have the same card that you may have. There could be different benefits loaded on those cards. I tell people this all the time. Some people only qualify for Medicare help, Medicare Savings Program. And then there are people that qualify for other things, such as food stamps. They might get money on it and other things. So make sure you know what you are eligible for and what you get on your card. And that's mostly determined by whether you're single or coupled, or mainly by your gross monthly income, whether it's rents that you collect. So if you have a house and you're paying $1,000 mortgage and you're only collecting $800 in rent, then they're not going to count the $1,000 that you're paying in mortgage, but they will count the $800 that you're receiving in income. So you want to make sure you balance things like that out. If you're receiving child care, that's included in your gross monthly income. So you want to be just, have all the information that you can. So that's it for Medicare Advantage plans and Part D plans. I think I want to talk a little bit about a legal service, okay? Most people, I sit down, it's a question on my confidential needs analysis that I do for the 4 areas that will affect your life. And one of the questions I ask is, do you have a will? Almost 90, maybe not that much, maybe that's kind of high, maybe 80% of the people that I ask if they have a will do not have a will. It's just a simple thing to have. Well, it's not really that simple. Let me retract that. I love the service that I have. I have a legal service, and I've had it for over 20 years. It has helped me in so many different ways. It's helped me with cases at work. It's helped me with cases with the city of West Haven that I had issues with. It's helped me with my credit. I was, when I was young, I had a credit card for every store available. As soon as I got my job, I think I was 19 or 20 or whatever, and I got 1 million credit cards. So I got myself in trouble. I didn't have enough money to pay them. And then, I just kind of let them go, like a lot of people do. And I generated the worst credit ever. And then later on in life, let's fast forward 15, 20 years. I'm able to buy a house and a car, and, I start my family and this, that, and the other. They all came after me. So with my legal service, I was able to get on the phone and call and, talk to my lawyer. And what he did, he wrote a letter to each one of my creditors, and they all went away, because consumer credit, if you have consumer credit and it's more than 6 years old, at least in the state of Connecticut at that time, I did not have to pay them. I guess the companies had written them off, but I didn't know that because I am not a lawyer. I am not a lawyer. He is a lawyer. He's an expert in his field. And he was able to write a letter to each one of them, and I never heard from them again. It never showed up on my credit report much later. As soon as it happened, yes, it shows up immediately. But 10, 15 years down the road, it had disappeared from my credit. And another thing I use it for is school that my son went to when he was in middle school. They didn't have in-school suspension, and they suspended my son, and I did not want him suspended. I had them write a letter to the school stating that I didn't want my son out of school for, these reasons, 5 days missing his work. He had to stay in school, and, punish him any other way, make him wash the floors, clean the cafeteria tables, humiliate him any way that you can, but do not put my son out of school. So I have used this service for everything. And that's where we kind of fall short. You have to have legal service. We're going to get in trouble. We're going to have questions. And I especially use it for driving tickets, for speeding tickets. I just got a speeding ticket last week coming back from North Carolina. I got in Virginia for doing 80. I know, shame on me. I'm sorry, but it did happen. So anyway, they're taking care of my speeding ticket. So those are the two pieces of information I want to give out today: Medicare Advantage plans and legal service. So please look into that. And unfortunately, I'm out of time, can't talk about anything else, but I want to thank you for joining me. This is the David Goodman Reality and Truth Show, and I'm on your side.